Hey everybody, Dr. Chris Green here in Parker, Colorado. Wanted to go over the implant process, including, the possible extraction and bone graft. This is what we use to explain to our patients to help them better understand how it works. Because there's a lot of stuff on the internet. You start Googling this stuff, it can be extremely confusing, and it can actually set you down the wrong path where you actually misunderstand what the process is all about. So let me review our timeline and how we look at this. So this example shows a front tooth where the patient's tooth has an infection and it needs to come out. So first things first is take the tooth out, clean the bone so that the bone is free of infection, and put a bone graft in, okay? We may or may not cover it with a small membrane, which they show here, and we throw a couple stitches in, okay? At this point, we're gonna let the area heal for about 12 weeks. So during that time, we're just letting it heal, letting your bone remodel and get strong again, okay? There are occasions where we can place the implant at the same time as an extraction. That's not the intent of this video. So appointment 1 is the extraction in this case. Appointment 2 is going to be placement of the implant. So this screw-like material there is the actual implant. And we do a 2-stage process. So when you leave that day, you leave with a cover screw, and as this heals, you will not be able to actually see the implant through the gums. So at this stage, we wait 5 months, okay, to let your bone grow into those threads and make it really stable. That's called osseointegration. After that 5 months, you come in and we uncover the implant, which means we expose it so that we can get to this screw hole. We take an impression, or now we scan it with a 3D scanner so you don't have to have that goop in your mouth. And that day, you then leave with what we call this cover screw, or a healing abutment. So that's a healing abutment. And then it takes about 4 weeks for the lab to get it back from us. You'll end up with a tooth, the abutment and crown. So all in all, that's the abutment, and that's the crown that goes on top. We can either screw that in as one piece or cement the crown onto the abutment. So all in all, you're looking at either a 6-month process from start to finish if we don't have to extract, or you're looking at a 9-month process if there's an extraction and bone graft. So I hope that helps provide a little more clarity on how the implant process might work. There's many more details to cover, so this is just a quick overview. Thanks.